Fab, we are live. Cool. So hi everyone who's joined us already. Thank you very much for joining. Happy Friday. Hope it's sunny wherever you are. I'm just going to give this a minute just to wait for any more attendees who might be joining, as we have only just gone 1 o'clock. And just while we do that, hi everyone. Yeah, I can see you all in the chat box. I was just going to explain where the chat box is, but I'm guessing you've all found it. Hi Alison, hi Yolanda, hi Tracy. Welcome, thanks for coming. If you can all hear me okay so far, if you could just say yes into the chat box, and also if you can hear Claire. So Claire, can you just say hi for us?
Hello.
Great. Okay, cool. Kate, Tisha, Nicola, everyone's saying yes. I'm guessing that our sound is good and we can all hear you. You can all hear us, sorry. Fab. Cool. So just while we just give this a minute, you can just kind of just keep saying hi in the chat box. It's nice to have a bit of interaction.
Yeah.
Probably the most interaction that I've had all week, so it's great. Cool. So if any of you did join us last week, we hosted a COVID-19 webinar with Hasbury Home Care Services. And just to say, we have moved to a new platform, as you can probably tell, as we did have some sound issues last time. So I'm really sorry about those sound issues, but hopefully we won't have the same problems this time around. But if you do have any problems at all, just pop those straight into the chat box. There's the team at Birdie are also on hand to help if we get stuck, but so far so good, I think, by the looks of it. The question, how many people are on so far? We have 46 people joining us today, which is great. And that's Ravi there. He said, we're here to help. So if you do have any questions, direct them towards Ravi and he is on standby. Cool. Okay, so it is now 1:02. I think a few more people are still trickling in, but what I'm going to do is I'm going to share the slides for the interview with you guys. There's not too much on there, but it just should help us as we go along. Cool. Just going to share those now. Fab. Okay. Can everyone... Oh, hang on, let me just double check what I've done. I have not shared my screen. Let me do that now. Share my screen. Share. Great. Can everyone see my screen?
I can.
Cool. Just leave that there for a moment. Okay. So before we kind of kick off into the main bulk, which is obviously going to be our interview with Claire, I just wanted to explain a little bit about why we're doing this webinar today. And that's because last week when we held our when we held our COVID-19 webinar, a lot of the Q&A we got was around PPE. Now, notably, it was how to get hold of it. I mean, that's a massive challenge. And also, it wasn't just that, it was about using it as well. Now, the first thing I will say is, me and Claire together, we don't have the powers to send you all PPE for your staff. But that being said, there have been some new government measures put in place last week and some supply chain updates this week to help secure more PPE. So hopefully that should be starting to come through. Now, we might not have all the answers, but if you do have questions, just put them straight into the chat box and I'll do my best to get an answer to you after we've done the interview and the webinar. And if we can't answer them live right now, then we will do our best to get back to you with an answer for those. Now, an important thing to note as well is that at Birdie, we are actively trying to push for solutions. Our newest joiner, Malte, who was the former head of strategy and intelligence at the CQC, is leading our COVID response from our side. And we are actively lobbying to help our care agencies and encouraging the national organisations to help centralise that data collection for PPE. Now, there's still a lot of uncertainty around PPE, and there isn't a quick fix for it. But by talking about it today and, by this webinar and hopefully the webinars in future, we can all come together and move forward to find the solutions. And that's kind of the purpose of this. So just to reiterate, I really want this to be collaborative. And while I can't actually see you guys are asking questions, the team are on hand and they're feeding those back to me. So please make sure you are putting any questions you have in there. And like I said, we will do our best to answer them. And if we can't do that now, then we will try and get back to you with an answer. So what I can do, aside from giving you all the PPE that you need, is help you understand how to use it. Well, Claire can do that. So the guidelines can be confusing, and we know that new guidelines have also come out yesterday, I believe. So that's why we've invited Claire to talk with us today about the correct uses of PPE, how we can use it, what's the right things to be wearing. And just to remind you again, any questions you have as you go along, pop them in the chat box and we'll try and answer those. So now we're already 3 minutes in. You're probably bored of hearing me speak. So I'm really, really excited to introduce you to Claire Sutton. She is the Digital Tech Lead at National Care Forum. So Claire, can you just first introduce yourself and tell our listeners a bit about what you do?
Hi, so yeah, I'm Claire Sutton. I'm one of the digital transformation leads at the National Care Forum. I'm also a registered nurse, and I have worked in social care as well as working in technology, which is how I came to be working at the NCF. The National Care Forum are the membership organisation for not-for-profit adult social care providers, and we're also part of the Care Provider Alliance, which is a wider group of membership bodies that represent lots of different aspects of adult social care, so including UK HCA, which I know some of you on the call will be members of, the UK Home Care Providers Association. Okay.
Cool, perfect. Thanks, Claire. Okay, so I'm just going to move those slides along. So the first question is the golden question. Now, like I said, we can't answer this, we can't give you PPE, but I thought it was important to kind of kick this off by saying, if care providers are struggling to get hold of PPE, where should they go, or who should they be talking to, or what's the latest that we have on this?
Okay, so the recommendation is to try and source your PPE through your normal providers. The issue with that is that actually within home care and within care homes, you possibly weren't ordering an awful lot of PPE before. So it may be that some of the PPE that you're now being asked to use isn't something that you would ordinarily have been getting hold of. So there is a hotline from NHS supply chain that has been set up. And even if you didn't previously use NHS supply chain, you can contact this number and the email address, which I think should be on your screen at the moment. The latest guidance that was sent out yesterday, which is it's more around discharge to care homes, but it does have some information in there around different suppliers that you may wish to contact. I can't guarantee whether if you contact those organisations you're going to get PPE, but there is a lot of work going on behind the scenes and at Department of Health and Social Care to ensure that home care providers and care homes do seem to be getting there. I can see somebody's just said on the chat that they are centering around in a circle. I fully understand that at the moment. They are working on getting it better, and I'm really sorry that I can't say that you're definitely going to be able to get it. We, as the National Care Forum, the Care Provider Alliance, and Birdie as well, we are really pushing to try and get this better. And I know that it is a problem that Department of Health and Social Care are aware of, and they are trying to get it sorted as well. And we are hearing some horror stories really about care providers just not being able to get hold of it at all. But hopefully this will get better, and I want you to know that people really are working behind the scenes to try and get this improved.
I think that's really, really important thing to say as well, Claire. I mean, we're not going to solve this right away. It's a massive, massive challenge. But the start of this is to collaborate more, to share ideas, to share our sources and work together to try and find a solution to it. But I think what we can do and how we can help is in explaining how to use the correct PPE. We know that there's a shortage of it, but when it does come through, I think that's going to be really, really important. And if we can be ahead of that curve, I think that's great. So the next question I have for you is, can you explain the types of PPE available? What care providers will receive if they haven't received it already?
Okay, so the initial deliveries that were sent out were 300 or it should have been 300 fluid repellent surgical masks, and that was a single delivery of a box of masks to each regulated care provider, so care homes and home care agencies, only ones that are registered with the CQC. So I know we're getting reports of people that run extra care or day centres and supported living that haven't received them, and that's because it was designed to be sent out to regulated care providers, which I know doesn't help an awful lot. The guidance changed a little bit last night, and there is new guidance on the government website around what PPE should be wearing and when, and the different types that are available. You'll see lots of different terms being bandied around, especially around face masks. So there's surgical face masks, fluid repellent surgical face masks, N95 masks, FFP3 masks. You'll see lots of people appearing on the news wearing great big respirator masks. There's loads of different types out there, and the government website does explain which ones are to be used in which setting. Will you receive any more from any kind of centralised location? We don't know at the moment. So there is talk of having a sort of command and control system set up whereby PPE has got a national sourcing and then distribution out to the different organisations, including NHS and health and the whole of health and social care. I can see someone's just said that table 2 is not clear on the guideline. Yeah, I
maybe
agree.
A bit about
spent a lot of time trying to work out table 2 last night myself. So and I think we'll probably get back to that a little bit later. I think that's something we're going to be looking at.
Yeah, for sure. There's been a few questions already, so yeah, guys, keep them coming, and we'll get to them. If they fit into our questions, we'll try and get to them within those. If not, then there's a Q&A at the end, so we will be getting back to you on those. I think maybe it would be important, Claire, maybe now if we just kind of talk about that new guidance, because that's really sort of fitting with the guidance has changed, but fitting with how to use the right PPE is super important. And we did have new guidance released yesterday, and for many that's really, really confusing, especially between, you know, what constitutes a session. So perhaps we could just explain a little bit about that for the listeners.
Yeah, so what constitutes a session is a little bit ambiguous, really. It's much more straightforward for people in home care than it is for people working in care homes. So on that table 2, it explains about sessional use and single use. Now, sessional use is that you wear the PPE for the delivery of care for a single care setting. So in home care, that's quite straightforward. You know you're going to take that off, discard it, and then go to your next visit. In a care home, it's a little bit different, and actually it doesn't clarify it very well at all. Yeah. Because the guidance for admissions from hospital to a care setting after COVID, and what PPE you would need to use and what isolation techniques you would need to use, suggests that you should support people in a care home environment in their own ensuite single room. So there's an argument to be had there around what's the difference between somebody's front door and somebody's room door. Yes. And that's where we're seeking clarification as to exactly what is meant by that sessional use. The guidance does refer to things like care for inpatients, which isn't appropriate for care settings, and I don't think it makes it particularly clear. One of the things that I think it is important to look at, though, is the difference between the aerosol generating procedures and other care-giving procedures. So aerosol generating procedures, that's when you need to use a filtering mask, so FFP3 or N95 mask, and where you'd need to wear long sleeve gowns and face or eye protection. And aerosol generating procedures are things like supporting somebody to use a CPAP or BiPAP machine, supporting somebody who uses high flow oxygen through nasal specs, people who use a cough assist machine, people who are having suctioning of their airways, or people who've got a tracheotomy or tracheostomy. So one thing that isn't an aerosol generating procedure that I know causes quite a lot of confusion amongst people is use of nebulizers isn't an aerosol generating procedure, weirdly, even though you can see all this aerosol being generated, it isn't. That's where it gets a little bit difficult for people, because actually in home care and in care homes in the past, if you had somebody that had a really infectious condition and was using an aerosol generating procedure, the chances are that person wouldn't just be in hospital, they'd probably also be in an isolation hospital. They'd be in an infectious diseases unit. The closest thing that I can sort of use as an analogy is if somebody had active tuberculosis, you wouldn't be supporting them in their own home with active tuberculosis and aerosol generating procedures. So that's where the COVID situation is very different to business as normal.
Yeah.
And that's where you really need to consider that, using that higher level of PPE if you've got it. And if you haven't got it, then you need to be raising that with people who are potentially able to support you getting that. So you need to be raising that with the NHS and your local commissioners to see if they can offer you any support towards getting that. I can't guarantee they're going to, but I think it's really important to be able to speak to your local commissioners and your local health partners to be able to say, look, we're supporting somebody here that's got a really higher level of need, and this PPE is not something we would have ever normally needed. How can we get it, and can you help us to get that?
Yeah, I think that's really, really important. And I think just before we move on to, you know, assessing the clients to make sure that you know what they need, there's just been another question that came in about using bin bags as aprons. And we also had some questions around communities providing PPE, like 3D printed face masks are a huge thing right now. You know, you're seeing it in the news that communities are creating these for the NHS and for carers. But is there any guidance on non-official PPE if you haven't got PPE at the moment?
So that these things have not been signed off by Public Health England. Yeah. They don't have a kite mark, they don't have a CE mark. However, they are being used, and people within the NHS are using them. They've been authorised as being safe by other nations.
Yeah.
So a lot of the 3D masks that have been used, I think it's Czechoslovakia or Czech Republic, where their health department have signed them off as safe. The NHS hasn't. So I'm not going to say go out and use them, because we don't know if they're safe or not. You could argue that something is better than nothing, but you need to be really careful, especially around things like using bin bags as aprons. When you are taking off, when you're donning and doffing your PPE, that's when you're at most risk of transferring any of the pathogens to yourself. So you need to be careful if you're using things like bin bags as aprons, that actually, how are you able to take that off in a really safe way?
I think that's really important as well. I mean, we were just speaking about how care providers might not have the PPE they need right now, but actually it could be more dangerous if they're using things that aren't certified and they're not safe.
Absolutely. I mean, it doesn't solve a problem, but you've got to be very, very careful. And I think that I know from when we started advertising that I was going to do this webinar, I've had like loads of messages on LinkedIn from people offering to sell me PPE from foreign sources coming over from China, and actually, do we know whether that's safe? And I do worry that actually care providers are almost being preyed upon by people that are trying to make a quick buck, and we don't know whether some of those things are safe. And in normal processes, we would have gone to a reputable supplier and purchased things that we knew were right. Mm-hmm. But there is a risk that when carers in particular are worried that their employers aren't able to provide them with the adequate PPE, that people might be trying to source things from quite sort of nefarious places.
I think that is a worry. And we've just had another question that said, well, another statement, I suppose, that says, our clinical lead told me we cannot make our own face masks as they're not compliant. And this is a big worry, because people are thinking, surely something is better than nothing, but actually they could be doing themselves a disservice. It could be more dangerous in some cases.
Absolutely. I've seen a lot of people who have been running up face masks on sewing machines.
Oh, wow.
The issue with that is that, yes, actually for the first couple of minutes, it might prevent things that would be landing on your face. but that fabric is going to become saturated pretty quickly.
Yeah.
And actually, if it's not fluid repellent, then the moment that becomes saturated, it is essentially just a perfect stream for pathogens to be able to transfer. And it can also run the risk of giving you a sort of false confidence that you've got something over your mouth, so you feel like you must be safer. So I certainly wouldn't advocate for people making their own. I understand that people are worrying and they are trying to think of a solution, but it could make things a lot worse than not using anything.
Yeah, definitely. And I think that's a big concern. You know, what do we do in the meantime? But I think it's in using what you have got. And I'm going to move on now to training, because I think this fits in really, really well. Now, we've said, you know, it's not better than using nothing if you're creating something that isn't actually working. But I suppose a really big question is, how do you then assess the clients who need their carers to be wearing PPE? And then how do you then train those carers to make sure they're only wearing it at the right time?
Okay, so the guidance online that was published last night, certainly for people that are being cared for in their own home, once you sort of look at that table, it is fairly clear. So what it says is that if you're providing direct care to any member of a household where any other member of that household has a possible or confirmed case of COVID-19, then you should be using that PPE. It also suggests that you should be using PPE if you are providing direct care or visiting any individual that's in that shielding group. So in the group of people that have received a letter to say that they must shield for 12 weeks.
Yeah.
So if any member of that household is in the shielding group and you're providing care to either them or any other member of that household, then you should be using PPE. There's a slight difference in which PPE you should use. So if it is a household where you've got a possible or confirmed case, then you should be using a fluid resistant mask. And if it's care where there's you don't suspect or you don't know that that person has it and they're not displaying any symptoms, but they are in that shielding group, then that's when you should use just a straightforward basic surgical mask. And these are single use within that setting. So this is where that sessional use is probably a little bit clearer for home care, that you know when you leave that house and you go to the next visit, you know that that's going to be a different session because it's a different setting of care.
Yeah. And that kind of thing, sorry, carry on. No, carry on.
With regards to training, there are resources again that have been put out on that website from gov.uk that have got images showing you what should be worn and where. You can print those off, you can email those to your staff. So people who need to know that can find that out. I've just seen something that says, so shielding everyone over 70. Shielding is the people that have been specifically told that they can't do anything for 12 weeks. So those people have received letters.
Yeah, that's what I was just about to say.
They're in that extremely vulnerable group, not just the vulnerable group, the extremely vulnerable group. So those people should have been notified directly by their GPs and received, if they've got mobile phones, they'll possibly have received text messages as well.
And I suppose as a care manager, if you have a care plan for those vulnerable adults, that should be made a note of, and the carers who are then caring for those older adults that are in the vulnerable group should be told, this person is high risk, they've received the shielding letter, we must be wearing full PPE or the surgical face mask when we visit those people.
Yeah, I've just seen a question that's come up about if a carer is claustrophobic wearing face masks, how could the agency manage that?
Yeah.
They need to wear them. It's PPE. I understand that if you're claustrophobic, it must be extremely difficult to wear them, but you need to be able to wear them for your own safety and for the safety of the people you're supporting. And personally, I wouldn't advocate for somebody to be able to say, I'm claustrophobic, I'm not wearing it, and then be able to go in and provide care in a household where people are vulnerable.
Yeah, I suppose it's also, you know, it's their safety as well. So we're protecting the older adults that we're caring for, but also the carers themselves, you know, they are exposing themselves and they need to make sure they're looking after their own health too.
Absolutely.
So we did just kind of speak about the single use, and we did hear before, so the new guidance has come out about the sessions, which I think is great. It's making it a bit clearer. But we did hear stories of care staff reusing PPE because there wasn't enough. Now, I think just reiterate the importance of not reusing that here, Claire, so if you don't mind kind of covering that.
Yeah, it's really, really important that you do not reuse single-use equipment. You wouldn't put on a pair of gloves that you'd already used, and this is the same. So yes, single-use means that you can't take it off and put it back on again. It doesn't mean that you can't wear it for a session of care. So if you're providing care within a enclosed environment, you can continue to use that same mask or that same apron, as long as you don't then take it off and put it back on again. The moment you take it off, it should be discarded. It's really, really important that people don't reuse single-use stuff. It's going to put themselves at risk. You've got to treat that mask as if it's got pathogens on the inside and the outside. You're not going to want to put that back on your face.
That's a really good point to make. And something you did just mention there is about disposing of it. So you've worn your mask and you've been to visit a client if you're a domiciliary carer. How should the carers then dispose of that PPE? Should it be done in the client's home? Should it be done outside the home? What are they doing with it afterwards?
Okay, so PPE should be disposed of as clinical waste. So if you've got yellow bags, orange bags, then you should be using that. Now, in people's own homes, you don't necessarily have that, but you should discard it, keep it to one side, and then after 72 hours, it can then be disposed of. So all of the evidence suggests that COVID-19 cannot survive on a hard surface after 72 hours, which is why you take off your PPE, discard it, 72 hours later, it can be disposed of as if it isn't clinically covered in pathogens.
So
ideally, yellow bags, orange bags, if you've got access to those.
So I suppose a tip would be then for a carer, perhaps once they've taken their mask off, pop it into the yellow bag or the orange bag, or if not, any bag, tie it up, maybe put a post-it note on it that says the date that they put the PPE in there, and then they have a log of when it was disposed of within the home, and then they know when it's safe to put outside.
Yeah, so after 72 hours, it's safe to discard it normally. So yeah, if you can, I fully appreciate that in people's homes, people do not have access to clinical waste in most people's homes. And that's the way you just discard it in a bag, tie a knot, put it to one side for 72 hours. That's quite important. I think, again, when you're taking it off, there is guidance online as to how to don and doff PPE so that you can take it off in the safest possible way.
We'll share that with everyone afterwards. We'll collate anything that we say here about guidance. We'll make sure that we collect that together and send it to everyone who's listening in an email. So you've got that, so don't worry about that at all. Now, the next one is about some kind of myths around PPE and usage. Now, there's a few going around, and I'm sure our listeners and you, Claire, have heard loads of them. But one that I've seen come up quite a lot is that vulnerable people who are discharged from hospital are going to be issued with PPE for their visiting carers to use. Well, they're going to keep them in the house for the carers to use. Now, have you seen any of that coming through? And is that, something that we need to be aware of?
Well, that would be lovely, but I've not actually seen, I've heard it, but I've not seen any evidence of it actually happening, unfortunately. And I know that this is of no help to anybody, but unfortunately, we are all kind of in the same boat. So the NHS themselves, they don't have enough PPE. They've probably got a bit more than us, but they don't have enough to be able to then share that out. I think as well, when you look at the amount that you're possibly going to be getting through as a care agency, even if they could only send somebody home with a couple of days, you'd be looking at quite a lot of stock. So unfortunately, I think that is a bit of a myth.
Yeah, that's kind of what I was thinking on this one. I think I'm just going to very quickly, there's just been a question come in that said about the yellow and orange bags. Should the council be providing these for care clients, or should that be something that the care providers are sourcing themselves?
I think, so in a care home, you put people's incontinence pads into a yellow bag and it goes in a separate yellow bin, and then that gets taken away by a separate bin lorry.
Yeah.
That's not the same as in home care, and actually the chances are you're probably going to be disposing of it in a normal black bin bag.
Yeah.
because there isn't the facilities to be able to dispose of clinical waste in the same way in people's homes. So you should continue, you treat the PPE as if you would treat any other contaminated waste that you're producing through giving that care. Yeah, I'm sure it'd be lovely if we could all get orange and yellow bags, but I just don't think it's going to happen. So I think actually keeping that for the 72 hours and then disposing of it in the normal bin is the best advice that I can give, really.
No, that makes a lot of sense. Now, that kind of leads on to the next thing that I'm going to say, which is I'm going to ask you about the latest hygiene guidance. Now, you know, we all know we have to wash our hands for 20 seconds. That's fine. But I do think there are some things that we should probably just cover here, just to reiterate and, you know, make sure we're all on the same page. Now, we know there's a shortage of PPE. We know that there's issues around that. But in general, what's the kind of hygiene guidance for carers who are visiting, you know, anyone, I suppose, in this situation? When should they use soap? When should they use hand sanitizer? Maybe we can just explain a little bit around that.
Okay, I'm sure this is pretty much teaching people to suck eggs here, but if your hands are visibly soiled, use soap and water. Wash your hands for at least 20 seconds. And most importantly, make sure that you dry your hands properly. Now, I myself have, when I was doing my training, I had district nurse placement, and I fully understand that there are some homes where you just don't feel that confident using somebody's towel to dry your hands. So if you can supply your care workers with paper towels to be able to do that, that would be a really positive thing to be able to do. It's just as important to dry your hands as it is to wash them. So at the end of any care visit, as you normally would, what you should do, take off any PPE that you've been wearing, wash your hands thoroughly, leave, and then you can use alcohol gel after you've left, because obviously you'll have touched the door handles in order to get out. But yeah, it's really important to know, as normal, if your hands are visibly soiled, soap and water is best.
Perfect. Thanks, Claire. Like you said, everyone knows this, but it's always good to reiterate, you know, those main safety guidances for hand washing. And there's just another thing that kind of falls under this that is maybe a new thing, because, you know, at Birdie, our software is an app. So carers are going to be using their phones day in, day out when they're visiting their clients. Now, you can't type on a smartphone with gloves.
No.
So they're going to have to remove their gloves to type down any notes or to mark any medications within the app. So when it comes to, you know, they've washed their hands, it's fine, but then they could touch their phone again and then pick up any kind of germs that were on that phone. So how should they best be cleaning their phones, and how often should they be doing that?
So I would suggest that you should clean that device as you leave an individual's property before you go on to the next one. Now, you can get antibacterial wipes, you can get sprays, you can get things to clean that. One thing that is important is, obviously, most people who are using these devices will probably have them in cases. Cases can be a bit of a harbour for dirt, so it's worth people, you know, if they take them home, to be able to maybe take them out of the case one day and give them a good wipe over. Obviously, don't go putting them in a bucket of soap and water, they'll pretty quickly break. But yeah, I think if you can wipe things down with an antibacterial wipe or spray, and obviously just be mindful of not getting them too wet. But as we know, COVID-19 can live on a hard surface for up to 72 hours. So we do need to be really mindful of cleaning those surfaces, and mobile phones and tablet devices are important to be aware of.
Yeah, for sure. Now, there's quite a few questions coming in, but I will get to those at the end.
Yeah.
So the next thing is just any more advice that you have, Claire. I mean, obviously, we wish we had all the answers, but I think right now, as a kind of final point, it would be good to discuss any advice that you have. And also, there's a certain element that I think is really important to raise here as well, alongside the general advice, is that we're seeing on the news constantly nurses dressed up in ICU wards, you know, head to toe in PPE. And there's a lot of panic around that. And a lot of carers may feel that they need to wear that. They may feel that they don't have adequate PPE. And that's something that I think is super important to address. And also how this then impacts their work. You know, how does it impact the people that they're caring for? So perhaps we could just kind of cover that sort of panic and news side a little bit first.
So I think when you see people on the television, they are generally showing people who are working in incredibly high risk areas. It's not very glamorous to show the average orthopedic ward or the average GP surgery or the average care home or the average home care visit.
Yeah.
And the people that you're seeing that have got full hazmat suits and respirator masks, they're working in really, really high risk areas. And I think it's really important to understand that context and to try and reassure your staff that just because you've seen somebody on the news that's wearing all of that PPE, that doesn't necessarily mean that everybody in health and social care should be wearing that level. And the guidance is in place to show you what you should wear and when. I think one of the things that you touched upon there was about how it creates barrier. If you're wearing a mask for somebody who is asymptomatic, they've not got any signs of COVID-19. So much of what we do as carers when we're working with people is about building those relationships. And straight away, you've got a mask over your face, you're preventing that method of communication. So I think that it's really important not to cause panic for the people that you're supporting, and not to cause panic for the staff who might be feeling like they have to wear full hazmat all the time. The people that you're supporting, actually, in the vast majority of cases, you're probably not going to have to wear that mask. That mask needs to be the FFP or N95. If you're doing an aerosol generating procedure, it needs to be a fluid repellent mask if you're going into any household where somebody has confirmed or possible COVID. And it needs to be a basic surgical mask if you're going into any household where somebody is in that extremely vulnerable group. So that's the 1.5 million that have had the letters to say that they must shield for 12 weeks because they are in that specific group. The rest of your visits.
Now, this kind of goes back to what we were saying. Yeah.
Go on, go ahead.
Sorry, I just interrupted you then, didn't I? I didn't mean to. No, sorry. I can't see you speaking on my screen. I can just see the slides. I was just saying that goes back to what we said earlier about training staff and making sure you're undertaking those assessments of your current clients to make sure that the right people are getting the right PPE for the right clients.
Yes. Yeah.
And there's just been a question that I just want to run over while we're talking here is, can you remind us of the mask to wear when actually nursing an infected person at home? I'm not sure which one's delivered to our registered office.
Okay, so if you are supporting a confirmed or suspected case of COVID-19, then you should use the fluid repellent surgical masks. So I believe that they should have been the ones that were issued out for as part of that initial delivery.
Yeah.
If you are supporting somebody who does not have any signs of either confirmed or possible COVID, and nobody else in their household has any signs of confirmed or possible COVID at the moment, then no face mask is needed.
Yeah.
And if you are supporting somebody who either they or another member of their household is in that really high risk vulnerable group, the 1.5 million that got letters, then you can use a basic surgical face mask.
So elderly clients over 70, if they're not at risk, they haven't been identified as that vulnerable high risk group, then there's no face mask required there.
No. So unless they are in that extremely vulnerable group of which they have been notified, then it's not blanket face masks for anybody over 70.
That makes sense, totally. Okay, there's still some questions coming in. So guys, if you have more questions, just post in the chat box. We're going to get to those very, very shortly. And the last thing I wanted to cover, Claire, was more from you. Working at National Care Forum, you probably have loads of advice that you could give our listeners right now, but I know there was a few things you wanted to cover. So I'd just like to kind of give the floor to you for a moment, just to share those with our listeners.
Yeah, so on gov.uk, there is loads of guidance about PPE. It is changing all the time. On our website, on nationalcareforum.org.uk, we are updating on our COVID-19 page every day following the daily bulletin. We're updating anything that's applicable to social care. One thing that I did want to add, and I know it's completely unrelated to PPE this, but NHS Mail is available to all adult social care providers. And it has been for a couple of years, but there's always been some hoops that people have had to jump through in order to get that. Those hoops, which are the completion of the Data Security Protection Toolkit, have been temporarily removed. So if you go to digitalsocialcare.co.uk, there is information on there about how you can sign up to have an NHS Mail email address. Now, the beauty of having this means that you can pass information across, secure, sensitive information directly with your health and social care partners. So if you've got concerns around an individual and you're needing to speak to their GP, you can facilitate that through a digital means, and it's acceptable for you to be able to share sensitive information because it is a secure, end-to-end encrypted NHS Mail account. There's loads of guidance on there. There is a helpline that the number may or may not be on there yet, but you might get to speak to me because there's only a helpline. But yeah, so I would really, really encourage all care providers, home care and care homes, to get their NHS Mail account, because at the moment it's a brilliant way of being able to communicate directly with hospitals who are looking to discharge people, local authorities, because it is secure, so you can use that NHS Mail account to communicate with your local authorities, GPs, district nurses, lots of other people that are involved in the support for the people that you're supporting.
Fab. Right, thanks, Claire. I think that's super important. So yeah, like I said before, we'll send around all these useful links in the email afterwards. So anything we've spoken about, we'll send this, and we'll also send you the slides. Now, I'm just going to jump straight into the live Q&A now. We've had loads of questions, which is great. So guys, keep asking questions. We don't have too much time left, but maybe we can just pick out a few and answer those. And any that we don't get to answer, we'll try and answer those in the follow-up for you. So we just have a question here. Let me just take a quick look at what we've got come in. So if a domiciliary carer is at a person's house for a 12-hour shift, should they wear an apron or gloves all day, or just when double up carers visit for personal care?
So it would depend on if the person that they were supporting had signs of possible or confirmed COVID, or whether they were in that extremely vulnerable group. So if they were in either of those two groups, so either they've got confirmed or possible COVID, or another member of their household has, or they're in that extremely vulnerable group, or another member of their household is, in that instance, yes, you would continue to wear that mask throughout the session. Now, in a 12-hour session, you're probably going to have a bit of a break to go and have something to eat yourself. Yeah. If you take that off, you put a different one on. Do not put the same one back on.
I think that's super, super important. And again, just worth reiterating, one use, one session. If you leave that house, you know, if you leave a carer's room, if you are in a care home, it's a different session. It requires a different set of PPE. So
it's a bit more confusing in a care home, and that's what we're trying to seek the clarification on, because actually what we haven't got a firm answer as to whether that setting is the individual room or whether it is the care home. It's much more straightforward actually in home care. I mean, in a lot of respects, it's a lot harder, very much on your own, but the guidance is a little bit easier to unpick.
Because you're physically leaving that home, which means that, you know, you're starting a new session.
Yes, yeah. If you're leaving somebody's home, going into another person's home, that is absolutely categorically a separate session, and if required, you must use new PPE.
Perfect, thanks. Cool. Another question here is, if a service user is requesting that you put a mask on to look after them, and I'm guessing, you know, this service user hasn't been identified as at risk, they haven't got symptoms, but they're requesting that you put a mask on, what do you do? Now, this is especially important because we have a lack of PPE. So if you've only got enough PPE to go around those people that have got symptoms or are at risk, how do you then broach that with the client to say, you know, no, or do you say yes?
So at the moment, the guidance suggests that there isn't any benefit to general members of the public using face masks. Now, that might change in time, who knows? The World Health Organization is definitely looking at that. But at the moment, we need to go with the best information we've got. And that doesn't say that you should be wearing that. So it might be a difficult conversation, but it is a conversation that you're probably going to have with that person and with that person's family members to explain why you're not doing it. because there isn't benefit to doing it, and quite rightly, we haven't got enough PPE to be using it in situations where we don't really need to be using it.
Yeah, I agree. And I do have some resources that I will share on communicating with clients, particularly those that may have conditions like dementia. And I will share those after the webinar in the follow-up email. So that will be coming across too. And hopefully that should help with any communication issues. Now, there's still a few more questions left on here, but we are running out of time. There's a few around being liable for if you're not wearing PPE, and that's something I think we can follow up with afterwards, because I don't have the answers to those, and Claire, we're not.
Do I? I'm afraid. I'm sorry.
Give legal advice. No, I wish we could, but I will follow up with those in the follow-up email to try and kind of cover off any concerns around those. Now, I suppose all that's left to say now is just thank you everyone for joining us today. I hope that you found it useful. I know I learned a lot, and like I said in the very, very beginning, we might not have all the answers for you, and I wish that we did. But at the moment, it's about coming together as best we can. So these kind of sessions, and we're hoping to run more of them, are just a really great opportunity for us all to ask questions. And I suppose as well, open up that floor. And at the moment, with us all being so remote, it's a great channel to kind of foster those discussions. So I've just put on the screen all of Birdie's details for social media, and Claire's and the National Care Forum. So if you want to hop on and follow us or follow Claire, I'm sure Claire won't mind if you fire over her any questions to do with PPE following this up.
I know there's a lot of people that are wanting clarification about liability and about where it leaves you in terms of insurance and post-COVID-19 inspections. I don't have the answers to that. I know that the COVID bill that has come into place essentially puts us in a situation as a nation where we're having to do things that ordinarily we wouldn't be doing, and therefore the precedent hasn't necessarily been set. So if you do have legal avenues that you can seek that clarification from, then by all means ask those questions. I don't know whether you'll get answers, but yeah, I'm sorry, I don't know the answers to those.
Yeah, like you said, it's a totally unprecedented time for all of us, and it's something we've never experienced before. So there's going to be those questions, but yeah, follow down the legal avenues that you can. And just to kind of finally finish up with this, like I said, we might not have answered all your questions today, but Birdie and National Care Forum and Claire herself and all of us together, we are pushing to the government and to the national associations to get clarification on this, to be more collaborative, to create more of a unity around the problems that we're facing in health and social care at the moment. So that's something that we really, really are working on. And of course, we'll be sharing that with you as we get more information. So please do follow us. And if you have any more questions for me directly or for Claire, feel free to email support@birdie.care. We'll get back to you, and we'll be following up with an email to make sure that you've got all of the resources you need, plus these slides, and hopefully a video of the webinar too, in case you wanted to watch it back. And that is all from us. So I'm just going to come out of this, stop sharing my screen, and say thank you very much, Claire, for joining us. That was super, super insightful. I hope that everybody else found it really useful, and I will be going through these questions and trying to get back to you all with an answer if I can, and if not, then I'll direct you to some resources that could help you.
Yeah, thank you very much for inviting me along. It's been an absolute pleasure, and yes, if people have got any further questions that we've not managed to answer, I'll certainly help try and find answers for you and get those emailed across for you.
Perfect. Well, thank you, Claire, and thank you everyone for joining us on this Friday. Have a lovely rest of your afternoon and enjoy the weekend. And I hope you'll join me for the next webinar. We'll be announcing that one soon. So stay safe, stay well, and stay distant.
Don't go out.
Thanks, everyone.